Welcome to the urinary system. I say this as kind of a joke. I mean, most people know that urine is ultimately determined by the kidneys, but there's so much more that the kidneys do. And urine is really just an indicator of the stuff, of the end result, right, that they did their job. And that's why we use it in urinalysis, because if there's something that shows up that's abnormal, then we can try to pinpoint what the problem could ultimately have been with the kidneys, or it could have been with another body part. But we have to, again, we utilize this solution to try to determine the overall health of the body. What we're mostly concerned with, again, is the balance of inside the body. So please know from this day forward that anything that shows up in your urine, of course, is something that was unwanted in the body, and it shows up so that the body can stay in balance or homeostasis. So to do this balancing act that the kidneys are responsible for, and the balancing of the body ultimately by affecting the blood. Clean the blood, right? Get rid of metabolic chemical waste or byproducts of drugs that you take, right? Got to be cleared, and that's going to be delivering the kidney ultimately getting them out of the body, right? So this is considered the urinary system is lumped with the respiratory because these two systems are excretory, right? So in this process, the kidneys will regulate your pH, because if your pH goes up in the blood, again, this is what we're talking about, and ultimately the body, then you have alkalosis, and the kidneys will have to bring it down. And generally they can do this by secreting or getting rid of bicarbonate. And if your pH goes down, well, then the kidneys could secrete or get rid of hydrogen ions or keep bicarbonate ions, and probably a little of both. Yes, it regulates blood pressure, absolutely. All right, so what the kidney's doing is affecting the systemic blood pressure, your hydrostatic pressure in your other blood vessels. All right, and some of that is done obviously by regulating the volume of the blood, but then there's other things that the kidneys can do to affect blood pressure, like the process of renin, production of renin. All right, it regulates the number of red blood cells. We learned this way back in the blood chapter. It has a hormone that it makes called erythropoietin, and erythropoietin, of course, is made when your blood oxygen levels are low, right? And then it produces active vitamin D, which is going to help the digestive system in the absorption of calcium. So we have a lot of interaction. The kidneys influencing every system in the body. All right, kidneys determine the composition of your plasma. If they fail, you face, right, and you don't need to know this from me, but this is the idea. It's not going to be a pleasant outcome, right? Most people understand, right, that the consequences of failing kidneys is death. All right, so your kidneys start to fail, you're going to have to be actively seeking a replacement, right? So, oops. All right. So physical characteristics of urine. So again, I said this is the waste. This is what we got rid of because you had an excess. So we have to know, overall what urine approximately has, what should be found in, what couldn't or shouldn't be found in that, right? So again, it reflects the amount you've eaten and drink. So this is a changing, right? The actual amounts of some of these things are going to change, but then there's certain things that should just never be in, right, your urine, like they show you here. There's about 3 million capillaries known as the glomeruli in your kidneys collectively, 2 kidneys, and so about 1 million to 1.5 million per kidney. And that's the site where you're going to filter blood. So the blood's going to leave the glomeruli and enter the kidneys. Again, it's a set of tubes we're going to call the nephron here in a little bit. So there's a certain size that's of molecule or thing, right, like blood, your nitrites, your glucose, your blood cells, that cannot move from the blood into the nephron, all right? So I say large stuff stays in the blood. So if we see something in the urine that we didn't expect, we have to figure out why. And I'm just saying here that, yeah, it could have been because you have damage to your kidneys and they've become leakier. I said the glomeruli collectively filter around 200 liters of fluid a day. So this means, your blood volume is only 5 to 6 liters, but it's repeatedly filtered, right? And of course, not only are you going to get this filtration we talk about up here, but most of this fluid is coming back. You cannot possibly survive and lose that, right? So minimally, about 2 liters will leave. So 99% of this volume is coming back to the body. And this will be the waste that you have to get rid of. And since it's liquid, it has to be measured as a volume like this. So again, urine, typically there can be slight odors due to diet or other, if you have pathology, yeah, but we said normal value. Volume, it'll vary, but in a 24-hour period, there's a range here. It really depends on how well you've been drinking and possibly other factors, but like temperature, all right? Hydration and temperature is probably the biggest influence. pH, it's a pretty wide range, like I said, because you're going to help maintain the pH of the blood by, right, making sure that if you have too much acid, you pee it away. If you have too much base, you pee it away, right? Specific gravity is really concentration. So this is low concentration, this is high concentration, and we're going to look at this in lab. Osmolarity, this really is a measure of the number of solutes in there, and again, this would it'd go a lot with this specific gravity, and it's really a concentration. Urobilinogen is a breakdown product from blood cells and gives the typical color that we see in blood, or excuse me, it's in urine, all right? And so this is a normal product in the urine. White blood cells, typically very, very low, and then enzyme, none of this, no protein or very, very little bilirubin, right? Again, ketones, typically not. You would have used those if you made them because you were in a famine state, or had a low-carb diet, you would have used them, so they wouldn't have accumulated. Again, this is normal. In diabetics, it would, right? Nitrates, no. That would be if you had a bacterial infection. Blood, no. Right? Glucose, no. All right? So a urinalysis can help us understand our internal problems. And so here's a range in color. And we kind of look at this, again, in lab. We reinforce this in lab. The volume of urine, the color of urine, the smell of urine change with diet and disease. All right? So I said there's some things, as we look at those normal values, that we could say, you know, how well hydrated you are or something you've been eating. The lower end, acceptable end, is about 500 milliliters a day, right? If it goes below this, and I gave you 750 to 2,000 milliliters on the last slide. If it goes below this, you have extreme dehydration or renal disease. You don't have to know the word oliguria. If you do not urinate, it's anuria, and excessive urination is polyuria. And I'm not going to use those words, terms, I should say, on a test, but that is the diagnosis. pH is affected by your diet, all right? So you have, if you're a vegetarian by nature, you have a higher pH. If you're a carnivore, your pH of your urine is lower. And this reflects, again, has to do with what ions and molecules are released as you digest these, as they enter your body, right? There shouldn't be cells in your urine, there shouldn't be protein in your urine, there shouldn't be blood in your urine, and there really shouldn't be ketones. All right? So we look here at the very simple movement of urine. So again, it's toxic waste we really want to protect. So most of the mucosa of these tubes outside the kidneys, and really the tubes to move urine start in the kidneys. And the vast majority of these tubes are lined with transitional epithelium, right? And this epithelium changes, but it's a stratified. It has many, many layers. It's just the layers change, and that's why it's called transitional instead of stratified, all right? So you have to remove it safely, and so female here, male here. The urethra begins in the bladder, right? So we have our bladders here highlighted, and we're trying to highlight, this of course is the uterus behind the bladder. So bladders, male and female. Between the two ureters, so we're seeing both ureters here, they just have cut where they come from. They don't show you the ureters coming down in the female in this picture, but that's okay, right? Would have come from the kidneys. And the ureters enter at the inferior, near where the urethra actually starts, and so there's these three openings, and so it's called the trigon, right? Urethra, as I said, all these, and ureters are all transitional epithelium. The bladder is transitional epithelium. The urethra ends as stratified, All right, so we just go ahead, because that means it doesn't really change in its numbers. It's got many, many layers, and it's protective. There are two sphincters to control in the urethra, and there's an internal and external, so this should be similar to what you think about when you think about the control of your solid waste in the around the anal canal. The external is voluntarily controlled, just like it was in the anal canal. All right. There are some differences between males and females that are visible here in the urinary tract. In females, much shorter urethra, 4 centimeters. In males, it's about 20. In females, it's in front of the vagina. Here's a vagina, so it's the first opening facing from anterior to posterior, and we have 3, right? 1, 2, 3, or 5. UTIs, or urinary tract infections, are common because of the short length and the distance from the anus. So it's very close to the anus. That's what I mean. It's not far from it. Whereas in a male, here's the urethra and here's the anus. There's quite a bit of a distance between the two openings. All right. Male also has 4 sections, and this differs a little bit from what Hole says. Hole didn't count 4 of them. They had 3 of them altogether, but that's okay. There's a pre-prostatic urethra. This is actually before we get into the prostate. There's a prostatic urethra, and you're not going to see this on your models. You'll see the prostatic urethra. You'll see the membranous urethra, which has the external urethral sphincter, because the internal is right here. Okay, and this is sometimes called the intermediate urethra. And then you see the spongy or penile urethra, which starts about here and just goes all the way down, and it is the longest section of the urethra. All right, the bladder in males and females is pretty similar, though I said the uterus is posterior, so behind the bladder in females, and places pressure on it during pregnancy. The bladder is partially retroperitoneal, so it's here's the peritoneum, so it's actually outside the peritoneal cavity for the most part. This shows you, this is a nice histology of this transitional epithelium that does, again, it looks like many layers. So here's where the urine would be, out here. All right, so the bladder is lined with transitional epithelium. When we look at it closely, has lots and lots and lots of mucus, glands formed in the submucosa, and then it has an awful lot of muscle that we're just missing here. All right, and here's our external urethral sphincter in females, and here's in this part of the urogenital diaphragm, I believe, and then the internal urethral sphincter really surrounds the urethra as right at the base of the bladder. Highly distensible. The wall is called the detrusor muscle, so it does have a special name for the muscle. It's not just the muscularis. And the lumen, again, is this transitional epithelium. And here this shows this trigon that we were talking about. The ureters come in through the bottom of the bladder. All right? All right, maturation reflex. This is control of urination. So here we see the neural plexus that controls this. It comes from the sacral region of the spinal cord, or spinal column. And urine leaves the urinary bladder by this urination reflex. So it's involuntary and voluntary, so much like defecation, right? Involves, again, like defecation, internal and external urethral sphincters. There are stretch receptors, just like in defecation, but now they're in the bladder, all right? And when the bladder is filling and gets to a certain point, then these receptors send an action potential to the sacral region. Right, so these are the sensors in here in the wall. They send it to the sacral region. And here in the parasympathetic, because that's who's controlling urination, the parasympathetic division of the autonomic nervous system then sends back and tells, right, the detrusor muscle in here to contract, right, and the internal, right here, sphincter to relax. So push and let it go. All right. Somatic motor neurons carry the impulses to the external sphincter, and here's showing the external sphincter here, just a piece of it, which will relax or contract voluntarily. So you're going to control this one, very similar to, again, internal, external sphincters in the digestive tract, in the anal canal. All right, we'll stop the video on this slide where it talks about the ureters, so we're moving upwards into the kidneys. So your ureter is about 30 centimeters, so not quite a half a meter. They extend downward, right, run parallel to the vertebral column. They'll be easy to find on the pigs, and join the urinary bladder in the pelvic cavity. All right, They have a inner mucosa, a muscularis, and connective tissue.